Good evening, everyone. We'll be starting the webinar in just a few more minutes as we wait for a few more people to come on. Thank you. Kia ora, and welcome to the University of Otago and New Zealand's National Centre for Dentistry webinar on undergraduate and postgraduate programs. I'm delighted to introduce you to the panel of speakers. First of all, myself, Victoria. I work within the International Office within the University of Otago. Mrs. Alison Meldrum, she's a specialist paediatric dentist and also the Faculty of Dentistry Director of Admissions, and she'll be talking to you about undergraduate study. Associate Professor Sun-Yong Ma. She's the Associate Dean of Postgraduate Studies and a specialist prosthodontist, and she'll be talking to you tonight about postgraduate studies. And then we're so lucky to have two students to talk to you today about what it's like to study at the University of Otago Dentistry School and life in Dunedin. So we've got Violina. She's an Otago University uni buddy as well, and she's in her third year of her Bachelor of Dental Surgery. And we've also got Adib. He's currently studying the Doctor of Clinical Dentistry. The majority of you listening to this webinar may not have an understanding of where the University of Otago is located. The city of Dunedin is a compact, student-friendly city located in the South Island of New Zealand, surrounded by nature and with very easy access to the country's top destinations and attractions in the South Island. This is an overview of the city. And as you can see on the right-hand side, we have our university campus that spreads into the city centre. Students mostly walk from their accommodation to classes and into the city. And there are a number of beaches. There are only 10 minutes drive from the city or by public bus. Dunedin's population is just over 130,000, but 25,000 of this number are students, which means Dunedin has the youngest population in New Zealand. 45% of the residents here are under the age of 30 years old. The city also has the highest percentile of intellectuals, with 36% of the people who live in Dunedin have PhDs. It's a true university city, with students and academics living side by side. People love Dunedin life. 84% of people rate the quality of their lifestyle as good or extremely good. And we are so proud to be New Zealand's first UNESCO Creative City. So throughout the year, you can enjoy art festivals, fringe festivals, Fashion ID Week, International Food Festival, international sporting and large music acts. It very much is a lively, energetic city. The University of Otago is New Zealand's oldest university, established in 1869. We like to reflect on our proud history of at least 150 years, as well as our world-class achievements in teaching and research, alongside our contribution to the intellectual, cultural, spiritual, and economic well-being of the world around us. Our main campus in Dunedin has been recognised as one of the most beautiful university campuses in the world by Huffington Post and the Daily Mail. The campus has an intriguing mixture of historic and state-of-the-art purpose-built buildings, beautiful green spaces, and the Leith Valley River flowing through the middle of the campus. Currently ranked by QS World Rankings in the top 200 universities in the world, as well as the Times Higher Education. Otago has been voted the best overall student experience for the last 5 years in New Zealand. Otago is the only university in New Zealand that has a Bachelor of Dental Surgery and postgraduate dental programs. Otago graduates have an excellent reputation internationally. Whether it is an undergraduate or postgraduate study, dentistry students are supported by top-class supervisors, and we're going to hear from a couple tonight, and taught in internationally recognised teaching facilities. Founded in 1907, it is New Zealand's national centre for dentistry and is ranked in the top 50 dental schools in the world by QS World Rankings. The faculty has a long and remarkable history of education, research and service to the community. A purpose rebuild has seen a fully operational 200-chair clinical services building. Patients are provided with oral health care that is supported by the most modern equipment and materials seen anywhere in the world. The Faculty of Dentistry's dental clinics undertake over 60,000 patient treatments each year. There are large spaces for teaching students simultaneously, such as in an operating theatre, 3 surgical procedure rooms, and areas for viewing scans and radiographs. Students are trained to use the most common electronic patient record software in Australasia, with many private practices also using a similar version. This allows graduates to keep up with any future digital developments in dentistry. The new dental building is one of the world's highest tech dental hospitals for learning and research. Sir John Walsh Building houses preclinical and research laboratories, meeting areas, and staff and student social areas. Of course, a university dental school is more than simply bricks and mortar. The Faculty of Dentistry at the University of Otago has a team of people who are the leading edge of their profession and who have an international reputation for excellence in research, education, and clinical service. The faculty is also fortunate to be able to attract many internationally renowned scholars who either choose to spend their time undertaking research at the facility or who are invited to visit the university. The Faculty of Dentistry offers a friendly environment for undergraduate, postgraduate training and education. A second new outplace clinic in Auckland was opened in 2020. The clinical centre in South Auckland allows students to obtain experience that build on their education and training in Dunedin and deliver the finest oral health care for the New Zealand and international communities. Please enjoy the following video. that shows the state-of-art technology you will be trained on.
Patients smile, the tutors smile, the students smile, and so when you're in a new facility, everyone just feels really good.
The dental school here at the University of Otago is New Zealand's only dental school, the National Centre for Dentistry.
I chose Otago because it was ranked really high, one of the highest dental schools in the world. In second year, it's a lot of sort of foundations that you need to sort of focus on. Third year, you transition into the clinics and you already have sort of a complement of patients that you're responsible for. And then in fourth year, you spend a lot of time learning about all the different specialties that give us the spectrum of what you can do with this degree.
There's opportunities to work in hospitals, there's opportunities to work in defence, as an academic, to work in general practice, to study to become a dental specialist.
It's an opportunity to care for people, to provide treatment, to interact with individuals in a way that's quite unique. We are, after all, surgeons, so we do surgical procedures in the mouth. The students are becoming experienced in the very latest cutting-edge equipment. It means that when they graduate from the University of Otago, they head out into practice very well prepared. They're very attractive to employers because they know about the technology, they know how to use it. It's part of their integrated workflow. And that sets them apart from students from most other schools, actually.
I would now like to introduce you to Mrs. Alison Meldrum, who will talk about the Bachelor of Dental Surgery and how dentistry is a challenging profession and very highly rewarding. Thank you.
As you can see from this slide here, that dentistry is much more than teeth. It involves social interactions, it involves understanding, it involves a holistic approach, it demands good communication skills, it demands empathy, sympathy, and a passion for what you're doing. You have to believe in what you want to do. We're lucky at the Faculty of Dentistry that we have other disciplines and other programs that we teach with, the Bachelor of Dental Technology and the Bachelor of Oral Health. There is some integration between the programs, not a lot, but the big, large common room that we have allows the students to interact into that common room area and have a lot of fun in there. And you'll see that, next please. Now you can see here that we talk about how dentistry and the curriculum is divided. It's got 3 themes that go through it, and these 3 themes are named with papers called DENT papers. They go DENT 261, which is the dentistry and the patient, DENT 262, which is the biomedical sciences, and then dentistry, DENT 263, which is the dentist in the community. And as you go up each year, the papers go up to 3, 4, and 5. And the programs are such that they link both vertically and horizontally. In your first year, most of the emphasis is on the biological sciences, where you do oral biology, some pharmacology, anatomy and physiology. This is a big paper and it demands a lot of you. Your clinical paper is an introduction to the clinical environment, to diagnosis, to examination, and the management of patients. A lot of the time is spent in our fantastic simulation clinic that you can use, but it's also getting to know techniques, getting to understand, as Dr. Swass said in the first video, that we are surgeons, we do surgical procedures, so getting to use your instruments, getting to use your hand pieces, getting to manipulate around a small little hole, that's the mouth. You also have to understand the ethics of dentistry and be able to communicate those ethics and public health dentistry concerns that we have, and that's the 3rd year papers that we have. And as you go through, you get more complicated with and the clinical aspect increases in its point value and its time commitment. And you get better skills, you learn to do different things. In your 3rd year, you're in a clinic that's a general clinic. In your 4th year, you have clinics that you get rotated out into going to oral surgery, to oral medicine, to paediatric dentistry, into orthodontics. So you're trying to link all your different skill sets into that. And in your final year, you have a basis that you are trying to link all this knowledge, and you have your clinics in general practice. Also in your final year, you have a clinical placement that you can do. The clinical placement is usually at our satellite clinic here in Dunedin called Te Kaika, and you go and spend a rotation period through there where you see people of Maori or Pacific Island or low socioeconomic groups or refugee student patients that need treatment, and they get treated in a different way, in that it's a more private practice emphasis at this Te Kaika clinic. Also, we have something that's becoming more and more important in the university is interprofessional education and interprofessional collaboration. And in second year next year, we're bringing in a bioethics interprofessional communication. And in third year, we have a non-communicable disease interprofessional education module that links all the health science professions, medicine, dentistry, pharmacy, physiotherapy, oral health, to develop patient care and understanding. So we all understand that patients are not treated in silos. And you can see here the different entrance pathways that we have. If you want to come in from health sciences first year, you must do health sciences first year at the University of Otago. And you can see the requirements that are here for Australian Year 12 qualification, NCA levels. The applications for health sciences first year close on December the 10th. Our entrance pathways are slightly different. We have health science, which I've explained to you, and a graduate pathway, and because you've got a degree from overseas, you'll come under the alternative category. And if you come, I'll start that again, but you must have the equivalent of health sciences first year to be able to enter this pathway. The deadline for this is the 15th of September. All the information is on the website, and there are really good guidelines about how to apply and what's required of you. The advantage of having our degree, as Victoria said earlier, was that we're internationally recognised. A number of my colleagues have worked overseas. I've worked a lot overseas too. And you can graduate and you can apply for registration both with our New Zealand Dental Council and the Australian Dental Board. And you have that advantage, although you're registered here, sometimes if you want to practice in other parts of the world, you might have to apply for registration or sit their registration exams over there.
Thank you so much, Alison. I'm now going to introduce you to Associate Professor Sanyong Ma. She started her Bachelor of Dental Surgery at Otago and is now a leading expert in the area of dental implants for patients as a specialist prosthodontist. As the Associate Dean of Postgraduate Studies, Associate Professor Ma will explain how you can advance your professional career or pursue a career in dental research.
Thank you, Victoria. So at the Faculty of Dentistry, University of Otago, we offer different postgraduate dentistry programs, ranging from postgraduate diploma to master's to Doctor of Clinical Dentistry, DDSC, as well as the highest, which is the PhD. If you have a look at the table on your screen, you can see the duration of different programs that we offer at Otago. For PhD, normally the duration for full-time candidate will be approximately 3 years. The same applies for the professional doctorate. In the professional doctorate, we have 10 endorsement areas, so ranging from endodontics, max facs, or medicine, or pathology, oral surgery, orthodontics, pediatric dentistry, periodontology, prosthodontics, and special needs dentistry. We're very proud to say that Otago provides the most various ranges of professional doctorates at the dental school. For the master's degree, we are divided into three programs. So one is the Master of Dentistry, and we offer two endorsements. One is the Aesthetic Dentistry and Rural Oral Health Care. Master of Dental Technology is also available, and the duration is 2 years. Master Oral Health is another degree that you can advance yourselves after doing Bachelor of Oral Health, and the duration is 12 months. For the postgraduate diploma, we offer 4 different disciplines ranging from community dentistry, CDT, dental technology, and dental therapy, which is approximately 1 year duration. For the entrance requirements, you'll see that for the Doctor of Clinical Dentistry, Masters, and the Postgraduate Diploma, we do require slightly higher condition to be able to apply to these programs. So obviously you'll need an equivalent Bachelor's of degree in dentistry, whether it be Otago degree or overseas. A minimal B+, which is 70 to 75% average in your final year papers. And we recommend that you have at least 2 years of general dental practice, and this does not include your internship. It's also a good idea to show us, especially if you are interested in doing decline dents, that there is evidence of some continuing education in the area that you're interested in applying for. Applications normally will close end of May, and at this stage we've just completed round 2 applications. Once we go through those applications, we may open for the 3rd round depending on which disciplines will be interested in doing so. After you've been successful with your application, so you'll be getting conditional offers, you'll be asked to provide us with blood test results as well as IELTS level of 7.5 with no individual band below 7. If you're interested in doing research degree, which is a PhD, I think the most important thing is to find yourself a supervisor. So you contact a supervisor in the area that you're interested doing research for, that you contact him or her and find out whether they are interested in taking a new candidate. After establishing some kind of contact, then you can move on building your research portfolio, the outline, so that you are able to apply to the PhD program. You also require B+ for your master's thesis and the IELTS of 6.5 with no individual band below 6. There is no application deadline for PhD, so it's open throughout the year. And if you are wanting to get more information, either visit us on our faculty website. Otherwise, we are also doing virtual postgraduate info evening in September.
Okay, I just wanted to let you know that if you are an international student that's currently in Australia and listening to this webinar, that you will be able to apply for a student visa through Immigration New Zealand as long as the travel bubble is open between New Zealand and your state that you're living in currently. There's maybe some domestic Australian students that are listening into this webinar, and welcome. Just to let you know, on the screen here, these tuition fees are international fees. For Australian students who got Australian residency citizenship, you will be paying the equivalent of what New Zealand students study, either undergraduate or postgraduate. So we do have undergraduate scholarships for domestic and international students. Any international student that's coming from high school into health science first year will be automatically given 10,000 New Zealand dollars for a tuition rebate. And then when students are in health science first year and you've applied for the Bachelor of Dental Surgery, we've got the Health Science Professional Scholarships, which have a value of 7,500. For both these undergraduate scholarships, there's no need for you to do anything. As long as you get the university entrance, you will see the $10,000 in your offer. And as long as you receive a place in the Bachelor of Dental Surgery, you'll be given 7,500. These are just one-off scholarships per year. We also have postgraduate scholarships for DClint Dent and PhD. For the university, these are both University of Doctoral scholarships. If you are lucky to get this scholarship, this isn't automatically given to you. It is merit-based. You will be given New Zealand 27,000 stipend per annum, plus the tuition fee waiver up to 36 months, capped at the domestic rate. And for those that are doing PhD, which is non-clinical, even if you're an international student, you will pay the same as a New Zealand domestic fee. That's why that's not a mistake. It's around $10,481 per year to do PhD. Right, now I'd love to introduce you to Violina. Violina is from Indonesia and is currently in her 3rd year of the Bachelor of Dental Surgery. Violina arrived in 2018 to complete the Otago Pathway program and came through Health Science 1st year, competing for a place into 2nd year of the Bachelor of Dental Surgery program. Currently in her 3rd year, Violina is a uni buddy, and you're more than welcome to contact her directly through our website on the international page. I'll hand it over to you, Violina.
Hi everyone, I'm Violina. So I'm here to speak for the undergrad student perspective. So I think so far my experience here at the Otago Faculty of Dentistry is very enjoyable. And I've also received quite a lot of support from the teaching and the administrative staff as well, in terms of that the lecturers and the clinical tutors here, they encourage us to think critically, and they also encourage us to apply all different aspects of theories that we learn in 2nd year so that we can so that it can be relevant to clinical dentistry. And I think the best part of it is that they are also very approachable. So it is really gratifying when I can, say to my peers back home that I can respectfully and comfortably email my professors when I have queries without feeling overtly intimidated. So personally, as an international student, this has become one less of a barrier studying abroad. And then another best part of studying here is probably the level of clinical exposure that I get. So in every week, we get 3 sessions of clinics with real patients as 3rd year student, and another extra simulation clinic per week just to practice on new things. And then this is very different to what we have back home in Indonesia, because I had a chat with a friend, a graduating dentist back home, and then that they told me how they have to recruit it or find their own patients, and they have to buy their own handpiece and materials like impression materials. So unlike here, which I'm very lucky to be in, everything's provided and the patients have been triaged so that they're suitable for a level of difficulties depending on what year you are as a student. So it is really nice to be able to learn how to work systematically from the get-go so that I can build this habit so that I can implement this workflow later after I graduate. And why I decided to go with Otago instead of any universities abroad is because when my parents and I were discussing about studying abroad, we agreed that I should really experience a whole new culture at once, and that's how we're set on New Zealand. So yeah, and I really like it here because it's quite quiet, though it has its vibrant days from the student cultures. So it's 50-50 of everything. And I think my parents feel more at ease too, knowing that Kiwis are super friendly, so that I wouldn't have too much of a difficult time reaching out for help if I ever need to.
Thank you so much. It's wonderful. I'm sure there'll be lots of questions that students will be wanting to ask you. So, yeah. Okay. Now I'd love to introduce you to Abe. Abe is originally from Jordan and he's also been living and studying in Dunedin since 2018. Currently he's studying a Doctor of Clinical Dentistry in prosthodontics. And Abe will tell us what it's like to study at Otago as a postgraduate student.
Thank you, Victoria, for the introduction. I'll start with why choosing Otago over other universities. So I joined Otago based on the previous dean of the dental school recommendation, Professor Paul Brunton, who was one of the external examiners in my final year FAB exam back in Jordan. So I met him. He told me about Otago. He worked in the UK and also New Zealand. He told me that Otago is as good as the UK universities or even better. Yeah, so I've checked the University of Otago. The degree is really great. It qualifies you to work at least in New Zealand, Australia, and maybe in Canada. Not sure about that. We have to check. And also, after completion of the Dent degree, you can apply for the membership of Royal Australasian College. So in some parts of the world, like in Middle East, for example, this membership is really strong on your CV. It's stronger than the degree itself sometimes. Yeah. So immediately after getting the degree, you can get that membership. So overall, the excellent reputation of the Otago, the strength of the degree, and also the friendly nature of the people motivated me to choose Otago over the universities. I'll also talk about the support and the clinical exposure that I received here based on my personal experience. So in terms of the clinical support, our supervisors are, I would say, I'd say the best, best in the field. They're experts. They're known worldwide. They have good clinical skills, good communication skills. They're very helpful. They're most of the time in their offices, so you can easily approach them, discuss with them any questions. And we have the staff offices and the clinics on the same floor, so the student supervisor interaction is very easy and efficient. In terms of research, we have the Graduate Research School. They offer workshops every month, lots of workshops in statistics, softwares, writing, everything. So if you're not sure about any aspect of your research, you can always get more than excellent support in these aspects. In terms of the clinical exposure, while the number of patients that you get to treat might not be as high as other universities, but I can guarantee that you will learn to treat patients the right way. For me, I'd rather learn to treat patients the right way, one patient the right way, rather than treating 50 the wrong way, or just so always quality over quantity. And that's it for me.
Fabulous. Well, that's really interesting. So are you nearly at the end of your...
I'm in my
last
final
year?
year.
So are you going to stay on?
I have to go back to Jordan as I have signed a contract. They pay the tuition fees.
Okay.
I go back for each year study 2 years. So. Okay. Then maybe after that I can come back.
I'd love to have you back.
I would love to come back as well.
Thank you so much. It's really interesting. Okay, well, now we're going to open it up to everyone that's listening to the webinar. I'm sure there are some questions and answers. One thing I didn't do at the start is I never told you that our wonderful colleague, Lauren Hall, is in the background, and she's been looking at the chat and answering some of your questions. Lauren, has there been a few questions coming in?
Yeah, I think some really good questions. A couple of things just around the different pathways, so the graduate category and the alternative category. I've also had a question here, which I'm wondering if someone wants to answer. I haven't replied to yet, but it's just looking to see whether New Zealand has a Commonwealth supported place for students where the government pays part of the fees, so I'm not sure that might just be to do with Australian permanent residents, but maybe if you could just talk about how Australian residents are treated if they're studying here in New Zealand for tuition purposes.
Yeah, so if you're on, you've got citizenship, basically you are deemed the same as a New Zealand domestic student. So you're not paying those international fees that you saw in the slide. You apply, you still have to apply at the same deadlines that were shown for the different categories, but you will basically be paying New Zealand domestic fees. With the Commonwealth Scholarship, you would have to look into research for that, and also sort of the Australian financial aid as well. In New Zealand, we call it study loans, don't we? Study link. But so the equivalent in Australia, I suggest if you want to come and study at Otago, to contact the equivalent in Australia and just find out sort of what financial support that the government can give you.
Yeah, great. We've got one more that's just come in. Can a student with a BDS degree and a PG certificate in health science join Masters in Dentistry in Otago? And is there any credit for a student in that situation?
So you can definitely apply to do master's degree in dentistry if you have BDS plus the postgraduate certificate. There is no cross credit for your points if that's what the attendee is asking. Yep, so it's a separate program depending on which master's program you're doing as well, whether it's MCom Dent or Master in Dentistry, which has 2 endorsements, aesthetic dentistry and rural oral health.
Great, thanks. Great, we had another question come in, and it's just generally around the allocations or places available for the Bachelor of Dentistry and through the different pathways as well. So obviously undergraduate versus alternative and things like that.
We have 60 domestic places, and of those, the majority goes to, 2/3 goes to health sciences first year, the other 2/3 goes to the alternative category. We have up to 35 international places, and that depends on what category the student applies in and whether they meet the admission criteria.
Great.
That's quite good odds, isn't it, for internationals?
It is. It's
Yeah.
better odds than domestics.
Oh, does it?
Right. So we've got a question here about the Bachelor of Dental Technology. So the question is, can high school leavers apply straight away for this program, or do they need to go from health science first year and then apply for it? So what's the pathway for
They can apply straight away.
Great.
Provided they've got chemistry and a background, because they have to do health sciences first year chemistry and physics.
The other thing too, for that student, when you are applying, you want to apply, you'll probably look for Bachelor of Dental Technology, and you won't be able to find the program online under application. What you're looking for is Health Science Undergraduate Program.
That's right, yeah.
Click on that in your application. So all applications are online. It's called the eVision portal. You'll be able to find it on the website. So if you're interested in oral health or dental technology, click on undergraduate health science profession, and then you'll see, once you're in there, it'll say dental technology, oral health, alternative, graduate, and that's the way you go in. Actually, on that note, I actually had an email come in of a Bachelor of Oral Health student who's currently at AUT, will be finishing their degree, interested in now coming and doing the Bachelor of Dental, Dentistry, dental surgery. What category should they choose?
Well, it depends on how long they've come in as a graduate, but they need to have the alternative of health sciences first year.
Okay, so alternative.
And or equivalent. And AUT, Bachelor of Oral Health program, is not the equivalent of health sciences first year. They don't have physics papers in it. Okay. So they need to have the physics, the public health, the hubs papers and things like that.
Right, and they would apply for alternative category.
No, they apply undergraduate category.
Undergraduate.
Unless they've been out for longer than 3 years.
Okay, yeah, all right. So those deadlines are the 15th of September.
So we've had a couple more questions come in around application processes. So I've got a couple of questions, one around what the weighting is for UCAT in the application process.
The weighting is, I can't tell what the weighting is at the moment because it changes each year, and they have to pass certainly the situation judgment test, and there's a different percentage for each of those different categories, and we don't know that until we've got all the results in at the end of the year. And the UCAT also helps us select the number of students that we will interview.
Right. So actually that leads to the next question. What are the requirements to, I guess, apply for an interview? I guess students, if they're successful, will be invited to interview. And if those requirements aren't met, but you've still got a student who's interested, what are the options from there?
If the student has applied for an interview.
Yeah, or
Has been given or offered an interview.
Yeah.
If they're overseas, and obviously if they're in Australia, we would arrange a Zoom interview. And then that would go into the mix of all the other things. And if the student gets a good interview score, then it goes on GPA.
Right. But if they don't meet the requirements before that, they wouldn't be invited to an interview.
No, they wouldn't, no.
Say the student is doing health science first year and they didn't get a place into dentistry.
Yes.
What would you suggest are the options if they still want to be a dentist, but just didn't get through? What are some of the
They
options?
have to do a degree and apply the graduate category way. So they would need to do that. And then they would be very careful to look at to see how the points are allocated to the different levels of the degree. So they try and get the best GPA. And there are different points, and that's also on the website about how we allocate second year and third year papers. 200 level and 300 level papers get allocated at a higher level than 100 level papers.
Okay. I was just thinking too, say you've got a student that's halfway through their Bachelor of Dental Surgery at an Australian university, and just with what's happening wants to come over. Yeah, no.
We have no pathway to transfer except students through other programs. Okay. So none at all.
I've got a couple more questions here. So one is around the Master of Oral Health. So for students doing that program, would they get registration to work as a dental hygienist following that?
No, it's not a registrational program. They have to be registered as either a hygienist, a therapist, or a dental therapist.
Great. I've got another question here. For a student who's potentially studying in Adelaide at their uni foundation year and they're in the dental stream, what's the eligibility like for coming into health science first year and then obviously applying for dentistry? Is that possible?
I suppose this they're talking is similar to foundation year, is it?
Yes, the pathway.
It'd be the path. And so they'll just apply for health sciences and the papers.
Yeah.
13th of December, don't they close?
Yeah. So so you'd apply for health science first year program, and and you've got until about the 10th of December to apply for that. Oh, by the way, all our applications are free too. You don't have to pay for it, because I've heard that if you apply to some Australian universities, there's an application fee. At Otago, no, it's free to apply, whether it's undergrad or postgrad. Yeah.
One thing I didn't mention earlier on is that there is actually an opportunity for students in their fourth year to do a BDSC honours. To do that, they've got to get at least an A minus mark in their BDS fourth year papers. And it's similar to the fifth year in that the elective paper is part of the research, and they do have to do another research proposal paper at the end of their fourth year, start of their fifth year. But it's quite an exciting opportunity to do it that way. Yep. And there's up to 8 places for BDS students to do honours.
Violina, are you going to go to the clinic in your final year? Are you thinking of doing that? Are you going to stay in Dunedin? Or?
Yes, actually, I'm considering going to the clinic. To Auckland clinic. So last semester break, I actually went up to Auckland to see what it's like, the dental school there. So I actually quite like it because it's kind of a compact version of what we have in Dunedin. and I've heard a lot of positive reviews from the previous students that have done their final year in Auckland. So yeah, unless something happens, I'm pretty sick and going to Auckland. Yeah.
Best of both worlds.
Yeah, exactly.
University
Yeah.
city, and then the big smoke, the big city in New Zealand.
Yeah.
So great.
My dad said that since you're already in New Zealand, might as well just experience everything that you can. So yeah.
Great. And Abe, what's like the support for postgrad? Like, and I'm not talking, you've talked about the academic support, but is there also sort of clubs and societies or a postgrad?
Yeah, there are a lot of them, but I'm a little bit of an introvert, so
Okay.
yeah,
That's right.
I want to be the right person to answer this question. Yeah, but yeah,
Have you come by yourself?
with my wife.
Right.
Yeah.
And has she found it comfortable here?
She's a dentist too.
Oh, is she?
Yeah. Yeah.
Right.
So she's very happy here.
Right.
She tried to start to study here, but we're waiting for a scholarship from Jordan, but we couldn't get it. So
So
but the thing that she's a dentist, so yeah, we can.
is she working then?
No, because she has to sit for the registration exam,
Oh, of course.
and then after that she apply for a license and things.
Oh, before too, earlier you said you weren't too sure if our degree's recognised in Canada, but it definitely is.
Yeah. 'Cause, yeah.
But you
I
have to
checked
sit
it,
the
but-
registration exams in Canada,
Yeah.
though. It's just like it gives you a pathway to sit there registering.
Yeah, but I think it's really shortcut, like not compared to other degrees, maybe. Not sure. Not exactly sure, but I think all the information are available on the Canadian Dental Association, maybe.
Is your daughter school age or is she just a little?
No, I have a 5-month-old.
Oh, 5-month-old. Oh, okay. I was just going to say because I
Born
thought,
as a Kiwi.
oh, that's so sweet.
Yeah.
Because of course, if she's from school age, as you're doing
Yeah.
a doctorate, they can just come in and any international students with children, it's just domestic fees, which is really
Yeah.
nice as well.
Yeah,
Yeah.
very nice.
Yeah. Oh, awesome. Congratulations.
Thank you.
Fabulous.
We've had a couple of other questions come in. Alison, I'm going to pass these first to you, which is just around the advanced standing pathway to come into the BDS program. So could you just outline what are the requirements, what would you consider the really important things, and how do things like a GPA and the UCAT and work experience, things like that, influence their application?
It definitely does influence their application because we do look at GPA of their degree. Also, we look at their understanding of that they've shown some evidence of looking about dentistry in New Zealand and understanding the dental program at the faculty and at their continued professional development that they've kept up and that and it hasn't been years and years since they graduated as a dentist from their own. And to apply, they have to have graduated from a dental school outside New Zealand and Australia. So it has to be an international dental school.
Great, thanks very much. And we've got another question that's come through. How many years should I study for Masters in Community Dentistry, and is it clinical or non-clinical?
So Master of Community Dentistry is a non-clinical program, and same work experience also is required, so approximately 2 to 3 year work experience.
Great, thank you.
Fiolina, as an undergrad, I'm just thinking about accommodation and the residential colleges that we have at University of Otago. There's over 14 to choose from, very similar to University of Melbourne and University of Sydney, that's sort of very collegial colleges. Do you just give a quick sort of overview to any undergraduate students how you found the college that you were in, meaning how did you find it when you were living in the college, and just a little bit about it?
Yeah, so I actually went there during my second year, and I think it's a great way to make friends because most of the students that got into the college would have been first-year students, and it's a good way to make friends because everyone's just new to the university and everyone's on the same boat. And then you get to express your interests as well, whether you're really good at sports, then you can play for the inter-college sports or the inter-college art performances. I think the best thing out of living in a residential college is that that's where you find your flatmates for the following year. So that's what happened to me. Now, right now, I'm flatting with my friends that I made from the residential college. So
Awesome.
yeah.
Yeah, I've heard that a lot of people make friends for life coming from a college, which is great. Cool. And also part of that $10,000 Vice Chancellor's International Scholarship is also guaranteed accommodation as well. But it's really important that if you want to go into a college, or we have university flats, you must get your application in by the 30th of October because they're incredibly popular with New Zealanders as well as with international students that are currently in New Zealand and Australia. Yep.
Oh, one other question that's just come through around registration. So can someone outline what the procedures are for an overseas dentist, so someone who's studied overseas, to actually get registration to practice here in New Zealand?
There's two pathways. There's the pathway of sitting our registration exams or having your degree individually assessed. And the Dental Council does that. The university has nothing to do with that. That's all Dental Council.
Great.
One thing that we didn't mention is that at the dental school, there's a really proactive Dental Students Association. It's really interactive. It covers all aspects of it. It covers both the social aspect, the support and pastoral care aspect, and also it has lots of educational aspects with it, and it has a proactive group that will look after you. You agree with me?
Yeah.
Yes, I'm sorry, I don't know why we didn't think of saying that first of all. It's and it's elected body, and also we have different year. For the BDS, we have a BDS 2, BDS 3, BDS 4, BDS 5 year group, and we have student representatives on all those groups that can give feedback and support and get changes in if they've got concerns. So you made the comment that the professional staff are caring and easy to access, and that's another way that can be documented and the students can get feedback and support.
Okay, well, it looks like that's sort of the end of our question and answer session. I just want to thank everyone that has been at this webinar. I was going to say tonight, but you might be listening to it from home tomorrow. So thank you everyone for coming along to this. And for everyone listening, I hope you found this incredibly useful information. Please don't hesitate to contact Ask Otago. If you've got any questions, if you need any sort of wanting to know how to apply, if you're from Australia and an international student, then they'll be brought through to the international office and we can answer those questions for you. And if you're an Australian domestic or New Zealand domestic listening, university also can help you with your questions as well. So thank you very much, and we hope to see you either in 2022 or 2023. Thank you very much.
Bye.